Well, hello, everybody, and welcome. Happy to see you today. Happy Thursday. And I've got a really great show lined up for you today. I'm really very excited. Today, we are going to talk with Eleni from Women's Nutrition Clinic. And today, we're going to talk a little bit more about actually a clinical topic that I think you're going to be really interested in, and that is PCOS. All right. So Eleni is really an expert in this particular area. So today is all about understanding your clients with PCOS, and we'll be talking specifically about just PCOS and must know information as a health professional. And really specifically, we're going to be delving into more of the functional and integrative approach to helping your clients with PCOS. So I think you are going to find it fascinating, especially because it's a very complex disease state, right? So, so Eleni, welcome. Really so happy to have you here with me today. It's always so much fun to reconnect with you, and
Yeah,
thrilled to see you, your success. So welcome. Let's kick things off. I'd love just to hear a little bit about your backstory. What led you to down this path in specializing with, in helping women with PCOS.
yeah. Thank you first for just having me here. Like, it's so great to reconnect. You've really supported me throughout the years, and helping me help more women as well. So I appreciate that.
Yeah, awesome.
So when it comes to PCOS, Polycystic Ovarian Syndrome, the reason I'm really passionate about it is because I had personally struggled with it years ago before it got a little, I won't say it's mainstream, but you can find more resources on it now. I think there are more dietitians and health providers individualizing in it. However, I was really struggling. So I was at the doctor's office. I was put on 5 different medications at one point. I felt awful. Mental health, physical health was really declining. And it felt really odd to me that growing up in a fairly healthy household, fairly holistic, that I was being given only medications and not really getting to the root cause. So at that point, I was also early on in my college career to be a dietitian. So kind of ironic. I was going through this health crisis while also furthering my education and a health career. But I was able to use that to understand that the body is complex. There's more we can do than just medication. Sometimes medications obviously can be appropriate for disease states. And so throughout quite a long journey, I was able to eventually reverse my PCOS, manage a lot of the symptoms, keep my body out of an inflamed state. And it only felt natural to me that once I became a dietitian, exposed to functional integrative healthcare, to specialize in this, because I do believe I can come from a very empathetic place and understand what women are going through, especially on an emotional level. I get it. And having actually the scientific background and the education. I'm not just a coach saying, do exactly what I did to fix my body. I'm coming with a full set of tools, clinical tools as well. So that's bit about the journey and why Women Nutrition Clinic exists. And I also just work with women that want to feel better and enjoy their day-to-day life a little bit more. So it's really fun what I get to do every day.
Yeah, that's amazing. Yeah, and isn't it interesting how, many of us start on a path and it's based on our life experience. Quite often that really has a huge influence on the areas that we decide to delve into. Certainly in your case, right?
Yeah, absolutely.
So, all right. So you were diagnosed with PCOS while you were in school. And really the only solution was, here you go, here's your 5 prescriptions.
It was insane. Yeah. Metformin, spironolactone, birth control, thyroid medication, anxiety medication. Everything was just off. And the medication made things worse for me in my situation. So it was crazy time. Yeah.
Okay. So, all right. Well, for our audience, let's talk a little bit about, what exactly is it? It's very complex. why don't you talk to us a little bit about, the definition and what it looks like in clinical practice?
Yeah. So as I will refer to it as PCOS, but again, it's polycystic ovarian syndrome. But not every female presents with ovarian cysts. However, to be diagnosed with PCOS, you do have to meet 2 out of the 3 diagnostic criteria. So this can be androgen excess, this can be the polycystic ovaries, or this can be ovulatory dysfunction. So changes in the menstrual cycle specifically. And it is the most common endocrine disorder among women of childbearing years. It's often confused as a reproductive disorder because a lot of women find out about it through infertility, but it's not just a reproductive issue. What's really fascinating about PCOS is there is a genetic component. And I do believe that we're seeing a rise in PCOS. And that's why I really want to share about it today, because numbers are going up. And it's because genes are being turned on. It's a very complex pathway. We're not exactly sure just yet, but we can look at our environment as a big driver, right? So that whole topic of epigenetics, why are these genes getting turned on in these women? So we can have this predisposition. It doesn't mean you're destined for PCOS. If your mother has PCOS, it doesn't mean you're going to have it. But if any female or patient has PCOS, it is important to look at, hey, did your mom have PCOS? Did an aunt have it? Did they have a metabolic condition that triggered it? So I think that's really fascinating that there is this
it is
underlying component.
Yeah, a lot of this does go back to genetics.
Oh, yeah.
And epigenetics in particular, right? Like which of those genes are being expressed more prominently than others. Yeah, super interesting. So it's not like there's one gene that they've identified, right? It's more like a compilation of how different genes interact. I would think, right?
And women with PCOS can actually have different root causes. So this is where we can get into more of like the integrative or functional approach. So what is that trigger, right? What's that? I always picture a light switch to me. So if that gene gets turned on, like who's turning on the light? So there's these various root causes. So I'll go through a few of them. One is inflammation, right? So if we live in an inflammatory environment, or we have inflammation in our body, if we have a chronic gut issue, if we have another autoimmune condition, if there's something that keeps bombarding our system, that can help turn that switch on. Insulin resistant. We see a lot of women with insulin resistance, but we don't, that's, I would say the more like typical PCOS that a lot of providers might be used to seeing, but that's not necessarily for everybody. So what's contributing to that? It could be a high carbohydrate diet, or the standard American diet, the SAD diet, right? That's contributing to that insulin resistance, turning that on. Some sort of adrenal related issue. So stress. This is where we see a lot of women with lean PCOS. So a lot of women that aren't overweight, they're getting the diagnosis. They don't have that insulin resistant state. Well, are their systems just overloaded? Are they super stressed? Are they the modern day female, right? Working really hard, maybe a mom, not getting that self-care time in, and even birth control. So women that had completely normal cycles prior, their hormones were regulated, and then they were on the pill, they're getting off of it. And that could have triggered something, because birth control can trigger changes in blood sugar and even insulin states. So hope that makes sense.
It does. I would imagine that, especially with women that don't have a weight issue, I'm wondering, like, how is it not until they try to become pregnant? What is the trigger for the diagnosis? Right.
Usually what I've seen is that. So women, fairly healthy weight, fairly, good health history. And then they say, hey, I've been on the pill 10 to 15 years and now I'm off of it. I'm trying to get pregnant. It's not working. I've gained a little bit of weight at this point. It's just kind of stubborn. So that can definitely be a trigger as more women are on the pill. There's no shame about that at all. We just have to know that it completely shuts down that connection, right, between our brain to our reproductive system. The pill can disrupt the gut microbiome. So if you have this genetic predisposition, something like that can trigger it. Women with PCOS are more susceptible to gut dysbiosis too, which I also find fascinating. So I think everything can kind of work together. So I do see that quite a bit. But then I also see women who have said, hey, my cycles have always been irregular. I've always been a little overweight. And then after years of not really addressing the core, it just kind of explodes. And then the symptoms get worse too.
Okay.
Mm-hmm.
Okay, interesting. So if I'm just a lay person, like when would I start to suspect?
PCOS.
In terms of the most common symptoms, like what would trigger me to go to my doctor?
Yeah, so some of the most common symptoms we see with PCOS, waking can be one, but like I
Yep.
said, it's not for everybody. But excess hair growth in unwanted places. Some women of certain backgrounds, I'm Greek and Italian, like you might have a little hair, but it's pretty obvious. Like if there's excess hair growth, if you're having to shave, pluck, wax, it's growing back worse, especially in hormonal areas of the body, like the jawline, above the lip, the chest, the back. These are areas that a lot of women complain of that excess hair growth. This is because of that high androgen state, the higher testosterone levels. Acne, adult acne can be a big sign if somebody has PCOS. Hair loss, gut issues, if there's some sort of inflammatory marker that's presenting on labs, blood sugar dysregulation, insulin dysregulation. So these are like a few. So it's more about like some of the main symptoms. But then if there's even some standard labs that somebody has drawn, especially blood sugar and insulin or testosterone, that's a nice starting point too.
Okay. So as a health professional, we've got lots of health pros watching today, big variety of different types of health professionals. Why is it important? Let's say someone doesn't necessarily specialize in PCOS. Why is it important to have a really good knowledge base around identifying clients with PCOS and just kind of having a handle on what to do about it?
Yeah, I think this is really important and why I was excited to share because, like I said, the numbers are on the rise, like infertility numbers, metabolic sort of imbalances. And it's important because it can really support a female in truly managing these symptoms. It can take effort, but these symptoms can be managed versus somebody having to struggle, be on medications, deal with symptoms, infertility, anxiety longer term. So I think as a clinician, just looking for, when you're speaking to your client, like, are their menstrual cycles irregular? If that's appropriate in their health history to ask. If they've been irregular, for how long? Do they notice excess hair growth in unwanted places? Are they dealing with acne, hair loss? Have they tried every diet, but they can't lose weight? Those are like telltale signs or questions you can ask about if and when appropriate to help a female get the appropriate care. Because again, these symptoms can be managed long-term. You don't have to be like a victim to your PCOS because it's incredibly debilitating physically and emotionally for women. And I think if we can work together and give the women just a little bit of relief, it goes a long way for the quality of their life.
Absolutely. And I want to welcome Karen. Hey, Karen. Happy to have you today. So Karen's got a couple questions. So do you find women without a weight/metabolic issue, do they tend to be underdiagnosed?
Yeah, I think that's a great question. I've actually find both. I find them underdiagnosed because, well, you don't fit that standard PCOS, picture.
Right.
And that's where I say, what's going on? Find out about their lifestyle. Are they like type A, like I said, like modern female type A? Can you do a little bit of testing where you're looking at how their adrenal cortisol is functioning? Can you look at their micronutrients? So I do find that they're underdiagnosed, but I also find that providers are giving a lot of women the diagnosis of PCOS when really it's like, are you just overstressed? And do we need to work on some sort of balance there? Is your blood sugar just slightly dysregulated? So I hope that answers her question. I do find underdiagnosis, but I often find almost like using the label a little bit too much to the point where we're totally ignoring the person and we're just giving them this stamp. And then they get a lot of fear around that and say, well, what's actually going on? You don't have a metabolic issue, but what is your root cause? Overlooking the root cause.
Okay. And then what are the questions we should have on our intake forms to help, to flag PCOS?
Yeah, really helpful. I like this question. So I would ask a lot about the symptoms. That's a great starting point. And if they answer yes to them, then you can do a little bit more testing if you feel comfortable, just some standard blood tests. But excess hair growth, you can ask about that on the face, the back, the chest. You could say excess hair growth. Where are you seeing it? If they're presenting in hormonal areas, do they experience adult acne? Are they having regular or irregular menstrual cycles? Do they notice hair loss? Are they noticing high amounts of stress? Those are some good questions to ask. Do they experience excessive hunger between meals? What is their fullness cues like? That's another player in PCOS as well.
Oh, interesting. Yeah, that makes sense. What about the anxiety piece?
Yeah.
Tell me a little bit, like, where does that fit in? And I guess what's the reasoning behind an increase in anxiety?
Yeah, love that. So women with PCOS can experience more anxiety or depression for a few different reasons. Some could be because of the hormone imbalance, so the swings in blood sugar, the higher testosterone. It can make you actually a little bit more moody and cranky.
Okay.
But then we have to actually look at, the female as a whole. All the females watching, I want you to think about it. Like, what would happen if your hair started falling out and you started getting a bald spot around the crown of your head? What happened if you started growing hair on your face, or you had acne and you had no idea why it was happening, or you had no idea how to fix it, and you're hiding, shaving your face behind your husband's back? I mean, these are things that these women deal with. So this part of the mental health piece of PCOS can absolutely be because of the symptoms. And there's a lot of pressure around women to be on diets with PCOS, to cut carbs, and that can cause a lot of anxiety. And women with PCOS are even more likely to have disordered eating patterns. So I'm really happy that we're talking about this, because something that I think is unique about my approach with PCOS with patients is, I'm not a therapist, but I keep in mind their emotional health, and I make sure that's being taken care of, because the disorder can be really, really challenging if you look at it that way.
They're getting hit from all angles, even disordered eating, which completely makes sense. So, oh my gosh. Really, I can't really think. Maybe there are more complicated disorders, but this has to be right up there in terms of kind of, unfortunately, just having such a wide range of really intense symptoms. Hey, Kim, welcome. So Kim, great question. Do you, Eleni, do you use any Dutch tests? Do you use the Dutch test?
Especially when it feels, absolutely, when it feels appropriate, because you're able to look at the trends in cortisol. You're able to look at the testosterone, the metabolites. You're able to look at if they were, especially on birth control, and they got off of it and they've been off of it for at least a couple months. You can see some of the trends in their hormones. So it can absolutely be helpful if you have access to that. And if people don't have access to that, just some standard blood labs can still go a long way. Vitamin D, their A1C, their fasting insulin, their iron stores, running a full thyroid panel. I can't stress that enough, because women with PCOS are more likely to have some sort of thyroid condition or hypothyroidism. So just want to throw that in there while we talk about testing as well.
Okay. Okay. So why don't we talk a little bit about what are some of the, I guess, myths or big mistakes that are kind of impeding this whole treatment process for women struggling with PCOS?
Yeah. So, one of the biggest myths is that birth control regulates the cycle. So that's a common treatment approach to say, oh, your period's irregular because of PCOS, just take birth control until you want to get pregnant and come back. Again, that completely shuts down the communication between your different body systems. It doesn't regulate the cycle. It gives you a fake bleed. So, I think this could be more for like the client to understand, but if your client's on birth control for PCOS, just be receptive and say, hey, what else are you doing? Are you working on your nutrition, your lifestyle? Because we really want to address this from a root, not cover up the symptoms. Another big myth is that women with PCOS can't get pregnant. Women with PCOS can absolutely get pregnant. I see it all the time in my practice, and it's, I think, one of the most rewarding things to see is if somebody is really purposeful about motherhood, they're able to achieve that. So when you address the symptoms, you get to the root cause, you get an individual ovulating, get symptoms under control. pregnancy can definitely happen. So this kind of goes along with like symptoms. People believe they can never reverse their PCOS symptoms, like they're locked into that for the rest of their life. And that's not true. Again, there's this genetic component. So yeah, a client or female will always have to take care of themselves. But we can usually manage these symptoms really well. And we don't have to be victim to them any longer. And one last myth I want to share is you have to lose weight to balance PCOS. Not necessarily true, because PCOS exists. Weight loss isn't always what's most important. So look at the person as an individual, not just PCOS as a syndrome.
Oh, interesting. Okay. So in your treatment process then, do you tend to use supplements as well?
Yeah, I'm a big fan of supplements. It totally in moderation, depending on the person. But if somebody is insulin resistant, inositol is wonderful. The blend of Metro and D-Chiro can be a nice alternative, especially if females struggle with gut issues due to metformin. This is really common. So something for practitioners to know, and it's also not going to deplete different vitamins like metformin does. So I love inositol when appropriate. I love adaptogens when appropriate. If one of the root causes is this, cortisol, high stress, just depleted state. And then if we want to do a little further support, if we're looking at the Dutch and the hormones, there's some nice herbs for that. And again, some just standard labs, run their iron, run their vitamin D. Everybody I see in my clinic is vitamin D deficient. And maybe a little bit of thyroid support if appropriate. So yeah, we could go on about that. Gut support, probiotics. PCOS is a total body syndrome. That's what we need to understand. We can't isolate the reproductive system. We can't just look at insulin. We've got to look at thyroid, other markers, hormones. And then from there, supplements can be really supportive, especially if females don't feel good about the prescriptions they've been provided.
And I'll bet like insomnia is a real big problem too, right?
Yeah.
I'm guessing.
Yep.
Based on everything I'm hearing.
Yeah. And what happens when you sleep? You heal, right? So sleep support is a big one. Absolutely.
Right. Yeah. So let's see. Oh, actually, good. A really good question. So what diet plan or eating pattern do you use to support clients with PCOS? Oh, and then a great question about soy. The $1 million question, right?
Yeah. So for starters, in terms of nutrition support, my philosophy that I use in my clinic is whole, real, organic, fresh, seasonal when we can. And I do take a really balanced approach. So I do tell clients, focus on protein at every meal, not too much, because too much protein can impact blood sugar too, in a negative way. Really focus on adding in good fiber, good healthy fats. And I do advise to actually add a little bit of high quality carbohydrates, about a half a cup at lunch and dinner. That's pretty specific, but for blood sugar, insulin regulation, we want to keep carbs a little bit lower in the morning, but carbs aren't evil. And this is important for the mental state of your clients, because remember, put yourself in their shoes. If they've had weight gain or they're trying to balance their blood sugar and they're being told don't eat carbs, and then they're being told to continue doing that, it's really hard for these women, or for what I see clinically. So balance, I find, is the best. Some examples of high quality carbs that I like to use are sweet potato, lentils, any of your winter squash. I even educate clients about seasonal fruit. Some of the lower glycemic fruit is better, but if they want to have a cup of watermelon, it's like, just eat the watermelon with your protein. So pairing protein, fat, and fiber are essential. And whenever a client is having a carbohydrate, always make sure they're having a little protein or fat with it as well. So that's sort of like the plan or approach that I use. I do emphasize 3 meals a day. Intermittent fasting, we have to be careful, because these women's systems can get stressed out really easy. Too much fasting, if they have some hypothyroidism, if they're depleted, if they're stressed, fasting can stress the body out more. So it's a fine balance. I kind of like 12, 14 hours from dinner to breakfast, and then 3 meals a day and maybe a snack if appropriate. So I hope that's helpful in terms of eating pattern. I find soy, based on like what I've seen, a little bit of high quality organic non-GMO soy is okay. The reason being is because we're not seeing this crazy impact on estrogen. But what is pretty interesting is that women who like Asian women, for example, from descent, have been eating soy for a long time, right? And so the studies are showing that when women are eating this soy, but they have this genetic like predisposition for it, they tend to do better. So in the Western world, what I say is, have a little bit of it, but don't overdo it. So I hope that makes sense. I think soy is okay, but there is definitely this genetic component or ancestral component that we want to keep in mind with soy. But I think with honestly any food. So I try to keep, I try to keep balance.
Yeah.
People variety, but not restriction too.
And then I don't know. Did you talk a little bit about the GMO based soy?
Yeah.
What are your thoughts around that?
Yeah, so totally like non-GMO. I really try to emphasize organic when possible. Avoid pesticides because that can all be toxins or inflammation that can totally impact obviously your hormones. And how else could people be getting toxic exposure through plastics, non-toxic cookware? So part of the eating plan that I talk about. Yeah, what do you store your food in? How are you cooking your food? If they can't afford organic, can they wash their vegetables really well? So trying to really avoid toxic exposure too is a big part of the eating plan.
Okay. All right. We got a comment here. Yeah. Validation of the Dutch test. Great. Yeah, I'd love to just spend a few minutes kind of changing gears a little bit, just talking about your practice. It's, if you don't mind, it's always super fun just to get an update on, just how, just from a practice building standpoint. I know you're seeing private clients. Tell us a little bit about like the different services you're offering.
Yeah,
including, I know you have a course as well that probably people here are going to want to learn a little bit more about.
Yeah, absolutely. So I have individual clients, so they go through usually minimum of like a 3-month program. That way, we're really moving through all of the pillars that I believe to be essential to support them in managing PCOS. That can include testing. I also have group programs. I have small group PCOS programs. I find groups really empowering because these women feel so alone in their symptoms. And just to be together in a group and to converse and to learn together, it's really, really beautiful to see and gotten good feedback about that. So we have some group coaching and then courses. So the point of the PCOS course that I have is to really fill in the gaps that I saw in the healthcare system for PCOS, both personally, but also professionally. So it's to give the foundational information. Foundationally, what should these women be doing for their nutrition, for their lifestyle, for their gut health? What lab tests should they be absolutely looking at that they can advocate for when they go to their doctor? So it's a really nice blend. I have a special guest that offers a PCOS workout. We do some meditations on there. So it's really interactive course. They get some nice handouts. And it's honestly something that practitioners can do. It's, a 4-week course. It's not, the modules aren't super long, and it's actually a way for you to further support your clients too. So that's a course that I offer as well.
Okay. So what I'm going to do is I'll put the link for Eleni's course in the chat. Hopefully you guys will be able to see that. So it's www.womensnutritionclinic.com. So that's her website, womensnutritionclinic.com/online-course. Or is it courses? Courses.
Yeah. We have one other fun course in there on libido and sex drive with a sex therapist, because a lot of women with hormone issues and PCOS can struggle with low libido. So if that interests you, that's a really fun interactive course as well.
Okay. Let me let me create a, I'll put this on the screen. There we go. So womensnutritionclinic.com/online-courses. So, well, one thing that I really love to hear is that you've been successful in creating multiple streams of income, one of my very favorite topics, right? And, you've created some leveraged offers, including, the group programs, which, is certainly a win-win all the way around, right? It helps leverage your time, and certainly your clients and patients, they feel really well supported being around not only you as their practitioner, but also other women in the group that are experiencing, similar challenges in their lives as a result of their PCOS diagnosis, which is so great. I love that.
Yeah, it's just speaking off of that, as providers, I think we all want to help, right? But it's so easy to get burnt out.
Yeah.
So it's really rewarding to say this feels purposeful. I'm reaching more people. Like, we need to address this, but not killing myself in the process. So it's really fun.
Right. And the thing that I hear day after day in the work that I do is, oh my gosh, like when my clients are able to do what you've done, and successfully offer a group experience for their clients, it's just like such a relief.
Yeah.
Because you're not, like you can say, you, instead of repeating things like 8 times a day or, 6 times a day, it's just such a relief to be able to kind of condense that right into fewer touch points in your day.
And you know what? I think what people need, I think the really in-depth testing, it's so powerful. But the foundations, like what got us here in the first place, people weren't probably doing some foundational stuff, at least for my audience. A lot of it's like foundational nutrition, lifestyle. And so it's so powerful to have groups when you can and say, wow, I can review a lot of these foundational pieces. And people are saying tremendous change. And so I like that you brought that up. It's like, yeah, you can enjoy yourself. You can not have to repeat yourself a bunch during the day, and they still get the message, the important message.
Right. Yeah. Well, maybe you can offer a couple of tips in terms of, because I know most people, most health professionals that I talk to dream of being successful, not only having programs and packages like you're doing, like the 3-month experience, moving away from the one-on-one sessions, but also building out what I call the profit pyramid and successfully being able to fill your groups. Any thoughts on that?
Yeah, I think it's being really targeted with who you want the group to be for, because the more specific, right, the more you get that person to come. And, allowing that group to be the most basic foundational thing. I think as practitioners, sometimes we want to give like every little thing, right?
Sure.
We want to give the information, but that can be overwhelming to people. So if you say, hey, I have this group offering, it starts X date, we're going through the foundations, through nutrition, lifestyle, like give them a nice little outline and make the group robust. So for example, I also give people a version of the online course. So little modules that they can do between. I give them access to log their food. So I think a way to make the group really successful is being specific about what you want to offer, but also have add-ons. And these add-ons, they're usually not going to kill you in the process. I don't mind giving a little extra, recipes or giving that extra course. It was fairly easy to put that together. And just making the timing right. So, on my website, when I have a group that's about to start, it's very targeted. Like the marketing is very targeted, like this group, this start date, schedule the discovery call. And I find actually scheduling discovery calls to be one of the most beneficial ways to get people in the group, because people don't know what they don't need sometimes. And you might think somebody's calling for an individual, but it's also a great way to discuss your program. And I feel like I learned that from you, is like getting on the phone with people can be powerful. So I hope that made sense or was helpful.
It does. Yeah. And I do think in terms of moving people into a group, it still is one of my favorite strategies to have a conversation with them.
Yeah.
And that really helps them to get to know you better as the practitioner. And also it just feels more personalized for them. They really see the value in moving forward. Because it's, let's be honest, it's depending on the price point, of course, but if it's, if it's a higher price point, I would say especially it's important to have a conversation, because people just don't tend to click the buy button for those higher end offers, because they're like, I don't know, maybe maybe another time. Right. So I think that's a really, really important strategy there. I did want to mention to everybody, make sure that you sign up for I actually have a brand new and I'm super excited about this, guys. It is going to really be awesome. Very robust. If you think multiple streams of income was full, wait until you see this new training. So it's called Sales Funnel Secrets for Health Pros, and I'm going to be teaching you how to create passive and leverage offers in your practice. All right. So I have the URL on the screen, leslievitale.com/funnel dash challenge. All right. So mark your calendars so that you're able to show up live May 3rd, 4th, and 5th at 7 p.m. Central. So we're going to do it in the evening again. Seemed to work out well last time. So again, that URL, leslievitale.com/funnel dash challenge. And actually, if you have another minute or so, we got a couple more questions that I think are really good. Thoughts on whole food, plant-based versus animal? Ooh, that's a good one.
Yeah, it's a great question. I'm glad you brought this up because I'd even mention it. So I do find with PCOS that women do really well with a little bit of animal protein. I just think from like a blood sugar perspective, even if the client doesn't have insulin resistance, still balancing that blood sugar is really key and essential. And if somebody chooses to do whole food plant-based, really look at their ferritin stores, make sure they're on some good supplementation. And it's really hard to keep a whole foods diet lower in carbs or a healthy amount of carbs. I find people tend to really overdo the carbs. So, an animal protein or animal foods, it doesn't have to be aggressive. It can be, a little bit of eggs, a little bit of fish. You could do a little bit of like collagen powder if somebody doesn't want to eat, red meat and steak every day. So I think it's a balance, but I do find animal foods are really, really beneficial for this sort of population.
Okay, great. Ooh, and I love this question too. So what about coaching versus MNT? Really great question. And then lab tests would interpretation. Lab tests would involve interpretation via MNT. I think that part's a question too. So what are your thoughts?
Well, yeah, this is another great question. So in individual programs, I kind of blend the two, and I say this to clients. I say, I'm here to be a coach to support you and ask you questions and help you work through like patterns that haven't been serving you in terms of nutrition, lifestyle, because these women have a very complex relationship with food. So we want to understand the barriers, what's keeping them stuck, etc. But the MNT is really essential, right? Looking at labs, seeing where each individual is. So I find it's actually a blend that works the best. Okay. But a lot of the foundational information can be very coaching based. Like that's what I do in the course. It's the foundations that these women need to know. And then if they want to do a little bit labs, they can do that. So I think a blend is best, but coaching is still a great start to at least get the education out there.
Yeah. I love that. Yeah. Definitely kind of a different approach, right? In terms of coaching versus MNT. And I love what you said about blending the two. And, I can attest to that myself because that's exactly what I used to do when I had my nutrition practice is really combining the two approaches. Yeah. And I think that works really well.
Because they've been told, don't eat this or just eat this or eat this amount of carbs per day. They need the support. And I think coaching is a really powerful piece to getting the message across and making sure it sticks. And so, I think the blend is really supportive.
Yeah. And I mean, at least from my perspective, coaching is more about aligning with the client and versus MNT is a little bit more, the orientation is more about, you being the expert, right?
Right.
So it's super interesting how those approaches are different and especially how we can blend them into a really, I think, effective approach.
Yep.
So, all right. Well, as we start to wrap up, any kind of final words of wisdom that you'd like to share, Eleni?
Just thank you for having me, allowing me to, be here and be an advocate for women with PCOS. And I think just like that word of wisdom is, if you can ever put yourself in that place, if somebody's talking to you about a symptom, if you suspect it's PCOS, and just listen to your client, because they know their body's best. And this population often feels very unheard. So thank you for letting me speak up for them. And if you come across a client where you suspect, just hold space for them. I know it'll mean a lot.
Okay, awesome. And guys, just a quick reminder to go visit Eleni on her website, womensnutritionclinic.com/online-courses. And one last reminder on my upcoming 3-day live event. Be sure to save your seat at lesliebytel.com/funnel-challenge. And I can't wait to see you there. It's going to be great. All right, guys, I hope you have a wonderful rest of the day. We're finally getting some sun here in the Midwest. So I'm excited about that. Looking forward to getting outside later this afternoon. Hopefully, wherever you are, you're going to enjoy some time outside. And all right, so look forward to seeing you all next week. Have a great rest of your day, wonderful weekend, and I'll talk to you all soon. Bye for now.